There are pains that appear suddenly, but there are others that give subtle signs over time, as if warning that something isn't right. Shoulder pain is usually like that. It starts quietly, almost unnoticed, a slight discomfort when lifting a bag, a sharp twinge when reaching for something higher, difficulty putting on clothes or fastening a bra. And without realizing it, that small discomfort turns into a constant presence that bothers you during the day and even disrupts your sleep at night. That's exactly what happened to Teresa at 67 years old. One day, while trying to open a window, she felt a sharp pain that made her drop everything immediately. At that moment, she thought she had torn something inside her shoulder. But in reality, the problem was something else, something very common in people over 60, rotator cuff degeneration. This problem can have different names, such as bursitis, impingement syndrome, or tendinitis, but they all describe the same situation. A tendon that is inflamed, compressed, or irritated and can no longer move freely. And when this tendon starts being repeatedly compressed, even the simplest daily movements become difficult and painful. But there is a very important piece of information you need to understand. The shoulder improves with movement, but not just any movement, only the right movement. You don't need excessive force, equipment, or long treatment sessions. What really makes a difference is knowing how to move the right way. Before talking about exercises, it's essential to understand what is happening inside your shoulder. Because when you understand the source of the pain, the fear of moving decreases, and you begin to act with more confidence and safety. The shoulder is the most mobile joint in the human body. It allows you to lift, rotate, turn, and move your arm in various directions. But all this freedom depends on a small and delicate structure called the rotator cuff, made up of 4 tendons that surround the head of the arm bone, keeping everything aligned during movement. Now imagine that between these tendons and the bone above them there is a very small space. When we are younger, this space is enough for movement to occur without problems. But over the years, due to poor posture, inflammation, or lack of mobility, this space becomes smaller. And that's where the problem begins. When you lift your arm, the tendon becomes compressed, literally trapped between the bones. This repeated friction causes inflammation, irritation, and over time, constant pain. That's why many people feel a sharp pain in the middle of the movement when raising the arm or when lying on the affected side. It's important to make this clear, this is not just weakness, nor a sudden injury. It's a mechanical problem. The tendon has lost the space it needs to move freely. The news is that this can be improved. The path is not complete rest, but the right kind of stimulus. Gentle movements that increase space within the joint, stretches that relieve accumulated tension, and specific exercises that strengthen and stabilize the shoulder. When you start working the shoulder the right way, it begins to move more freely again, the pain decreases, and simple daily tasks stop being a challenge. It's a gradual process, but completely possible, even as the years go by. If this explanation is helping you better understand the source of your shoulder pain, that is already a big step. Because when you understand the problem, you stop being afraid to move and begin to act with more awareness. Now let's start with the first exercise, the one that serves as the foundation for the entire recovery process. The first movement is the pendulum exercise, and it is considered one of the safest and most effective for people with shoulder pain, especially after the age of 60. This is because it allows the joint to move without requiring direct effort from the irritated muscles. It's almost like a relief exercise. It doesn't require strength, large range of motion, or perfect precision. What it asks for is simple: allow the shoulder to relax and move naturally again. When a tendon is inflamed or compressed, forcing movement only makes things worse. The pendulum does the exact opposite, it frees the joint without creating pressure. To do it, place one hand on a table, chair, or any firm surface. Let the arm that is in pain hang completely relaxed. Lean your torso slightly forward, allowing the weight of your arm to assist the movement. Now comes the most important detail. You should not move your arm directly. The movement comes from your body. As you gently sway your torso forward and backward, your arm begins to move on its own, forming small arcs. If you make a slight rotational movement with your body, your arm will begin to draw natural circles. The key is to let your arm follow the movement, not control it. This simple gesture creates several benefits at once. The joint relaxes, stiffness decreases, circulation improves, and inflammation begins to reduce. The tendon that was compressed gains space to move again. Many people describe this sensation as internal relief, as if the shoulder can finally breathe. Do this exercise for 1 to 2 minutes, always without pain, using light and continuous movements. It serves as preparation for the next exercises, which will require a bit more control and activation. Once your shoulder feels looser, we move on to the second exercise, which has a very important goal, teaching the shoulder to lift the arm without pain or compression. This exercise is known as the wall angel. It is extremely effective because it works exactly the areas that weaken the most over time: the upper back, the muscles responsible for posture, and shoulder movement coordination. All of this helps restore freedom and confidence when lifting the arm. To begin, stand with your back against a wall. Try to touch your heels, glutes, upper back, and head to the wall. If you can't get everything to touch, that's okay, it's common, especially if you tend to have a more rounded posture. From this position, raise your arms to form a W shape, with your elbows slightly bent. Then slowly slide your arms upward, as if turning that position into an I. Do this slowly, without forcing it. If you notice your elbows or hands coming away from the wall, reduce the range of motion. The most important thing is not to go as high as possible, but to maintain control and avoid pain. Breathe calmly during the movement and focus on activating the back of your shoulders and your shoulder blades, as if gently bringing them closer together. This exercise helps reorganize posture, create space within the joint, and allow the arm to lift again without that typical discomfort. With practice, you will notice that the movement becomes lighter, more natural, and less painful. And this is a clear sign that your shoulder is returning to how it should function. Then slowly return to the starting position, always maintaining control of the movement. This exercise plays a fundamental role because it corrects one of the most common causes of shoulder pain: forward rounded shoulders. When the upper back is weak, the chest tends to collapse, the head moves forward, and this position reduces the space where the tendon should move freely. By practicing the wall angel regularly, you begin to restore the supportive function of the thoracic spine, open the chest, and allow the shoulder to function more naturally again. Many people notice that, over time, their posture improves almost automatically, without conscious effort. Perform 6 to 8 repetitions, always slowly and with control, feeling each phase of the movement. When you begin to feel more openness in your chest and less stiffness, it's time to move on to the next exercise, which directly targets the front of the shoulder, one of the areas that most contributes to tendon impingement. The third exercise is the doorway stretch. This movement is essential because it counteracts the shortening of the chest muscles, something very common as the years go by. Daily activities like using a phone, cooking, reading, or leaning forward cause the shoulders to roll forward, closing the chest and further reducing the space inside the shoulder joint. When this shortening occurs, the shoulder loses proper alignment, the shoulder blade shifts out of its ideal position, and the tendon ends up being compressed. That's why, after working on mobility, it's essential to release this area. To do it, stand facing a doorway and place your forearms on the sides, with your elbows at shoulder height. Keep your spine upright and your chest open, without tensing your neck. Take a small step forward, just enough to feel your chest stretch. Do not force it, the goal is to feel a comfortable stretch. Stay in this position for 20 to 30 seconds, breathing deeply. With each breath, try to relax the area more. This stretch directly targets a small but very important muscle that influences shoulder position. When it is tight, it pulls the shoulder forward and downward. When it is stretched, it allows the shoulder to return to a more balanced position. Over time, you will notice that your arm movement becomes lighter and freer, as if your shoulder has more space to function. Perform this exercise 2 to 3 times a day for the best results. After releasing the front, the next step is to work on the back of the shoulder, which is often overlooked but plays a fundamental role in joint balance. The fourth exercise is the crossbody stretch. It helps release the back of the shoulder, balancing tension between the front and the back, which is essential for restoring full movement without pain or limitations. Although many people don't realize it, tension in the back of the shoulder can be just as limiting as tension in the front. When the posterior deltoid and posterior capsule become tight, they push the head of the humerus upward and backward, increasing friction inside the joint. This is what causes that sharp pain when you try to bring your arm across your body or reach to the other side. To relieve this area, raise the affected arm to chest height and bring it across your body, as if giving yourself a hug. With your other hand, hold your elbow and gently pull it toward your body. This stretch is especially important as the years go by because lack of movement or even fear of pain causes this area to become stiff. When that happens, the shoulder loses its natural alignment, the rotator cuff has to work harder, and the tendon ends up being overloaded. By releasing this posterior area, you restore balance to the shoulder and reduce the internal pressure that causes discomfort. Perform this movement once or twice a day. It is simple but essential to prepare the shoulder for the next step, which is strengthening. Now we reach the final exercise, and perhaps the most important of all. After improving mobility and relieving tension, it's time to restore stability to the joint. Without strength in the stabilizing muscles, the shoulder loses control and the problem returns. The isometric external rotator exercise is ideal because it strengthens without causing pain and without requiring a large range of motion. Stand next to a wall and bend the elbow of the affected arm at a 90-degree angle, keeping it close to your body. This position is essential to avoid compensation. Place the back of your hand against the wall and, instead of pushing hard, apply light pressure as if you were trying to rotate your arm outward, but without actually allowing it to move. Hold this contraction for 5 to 10 seconds, breathing calmly. During this time, you will feel the activation of deep muscles in the back of the shoulder. These are small muscles, often overlooked, but extremely important for joint stability. When they are strong, the shoulder moves with more control, reducing the risk of pain and preventing new episodes of inflammation. This exercise represents the final step of the entire process. First you release, then reorganize, and finally strengthen. It is exactly this sequence that allows the shoulder to function safely, smoothly, and without pain in daily life. These muscles act as true brakes for the shoulder. They prevent the arm bone from rising improperly and ensure there is enough space for the tendon to move without friction. When these muscles are strong, the shoulder functions again with balance, stability, and safety. I remember the case of Rosa, a 68-year-old woman who had practically stopped using her arm because of the pain. Any attempt to lift it caused intense discomfort. When I evaluated her, I noticed that her stabilizing muscles were extremely weak. We started with simple, gentle isometric contractions, just a few seconds per repetition. Within a few weeks, she came back saying something that sums it all up: she felt that her arm was responding again. That sense of control is exactly the goal of this exercise. Perform 8 to 10 repetitions, always without pain, gradually increasing intensity. This deep strengthening is what will prevent the problem from returning and allow all the other exercises to keep working over time. Before continuing with the routine, it's important to take some precautions. The shoulder is a sensitive joint, especially when inflammation is present. A mild stretch or pressure is normal. But intense pain, a shock-like sensation, loss of strength, or sudden limitation are not normal signs. In these cases, it is best to seek a specialized healthcare professional. It's also important to watch for warning signs. If pain wakes you up at night, if you cannot lift your arm even slightly, or if you don't notice improvement after a few weeks of practice, it's worth seeking a more detailed evaluation. Now, looking at everything you've learned, it's important to recognize what has begun here. Each movement, no matter how simple it may seem, sends a clear signal to your body that it can recover. The shoulder is not broken, it is limited, and with the right stimuli, it can function better again. Progress happens in stages. First, stiffness decreases. Then, movements become lighter. Over time, simple activities like getting dressed, reaching for something, or sleeping without pain become natural again. Don't expect immediate changes, expect consistent progress. The shoulder improves with practice, patience, and consistency. And the most important step, you've already taken it, you started. Continue taking care of your body with attention and respect. Small actions repeated daily have a huge impact over time. If this content helped you in any way, I want to make you a simple but very important invitation. Subscribe to the channel and turn on notifications so you don't miss any future routines, new exercises, or practical strategies to keep your body strong, mobile, and pain-free over the years. Now tell me in the comments, which of these 5 exercises brought you the most relief, or which one do you feel you need to work on the most? Your experience can help others who are going through exactly the same situation. I read every comment, and that's what guides me to bring content that is increasingly useful and closer to your reality. See you in the next video. And remember something essential: your body still has a great capacity to improve, adapt, and regain strength. With consistency and patience, step by step, you'll get there.